mild positive to the lower limb flexion and quite a bit positive to the upper limb flexion. We know that he has stifle and hock disease, and we're going to look at this radiograph, and we're going to go and treat with alpha 2 and arginine, which is the polyacrylamide gel. One of the favorite things I get to do as an equine veterinarian is waking up every morning and enjoying a beautiful view like this to do exactly what I love, what I wanted to do since I was a kid, which is to be an equine veterinarian. Follow me through our appointment today. It's going to be a great day. And remember, if you're an equine veterinarian that's looking for more experience, or you're a seasoned veterinarian, we have a job for you. Our expansion is coming out extremely good, and we are looking to go on the West Coast as well as the East Coast. So PM me, because I have a lot of opportunities for you. When he has a lot of hair like that, we are starting to get a big concern about Cushing's disease and metabolic abnormalities, which is very common. As a matter of fact, horses that are more than, in the older range, more than 20 years of age, they are very predisposed to it. They did a study where about 90 or 93% of them were affected. Yeah, I agree with you. The right hind is a bit sticky, huh?
Now, if you think that you need to check them for the Cushing's, if you could do something to help delay that process.
Yeah. We'll look at the.
Because I lost a mare to it. I lost a mare to it. You know what she ended up getting? Sinusitis from gingivitis from the Cushing's. It was awful.
Because the immune system goes down.
Yeah, I know he's over 20. I don't care what they told me at the auction.
What we might do, we might just start him on the placenta.
Right.
So have you been riding him?
A little bit.
A little bit.
Not a lot, because he doesn't seem real cooperative. So until I came to you, he was probably out last week.
Okay. He's not horrible, but I would say he's
just a little bit, and I think a little uncomfortable. So
1 to 2 out of 5 on that right hind.
Yeah.
We're gonna be tackling that right hind today.
But you know, he's got the stifle. He's got the freaking hock. He's got the so.
But let me tell you,
I really think the stifle and the stifle that you hit with the alpha 2 last time, I think really helped.
Look at this. This is way less swollen than previous.
Yes. You know that when you did the alpha 2 last time and the stifle, I think that really helped.
How long ago was that?
6 months.
He's due.
I know he's due, but you weren't here. You were out gallivanting.
Oh my goodness gracious. You see what I have to put up with? You see the crap?
You were out taking care of the fancy horses.
The crap I have to put
Oh,
up
I got one more thing to bring up while he's over there.
1, 2, 3.
I got one more thing to bring up.
Yeah, bring it. The horse that we're working on, we've seen it almost exactly a year ago. And I'm going to show you in the radiograph some very interesting findings. Look at the hock. This is the right hock. And I'm going to zoom in so you can see how there is almost these two bones are touching each other. It's like a bridge, like a bridging. He is definitely losing joint space in these hocks. Let me pull up another radiograph. Oh, this radiograph confirms it. This is the right hock. You can see the R over here. And right here there is obvious decreased joint space on this hock. Interestingly, he also has it on the left hock, which is not lame today at all. I'm gonna show you a radiograph of the left hock. Almost looks worse on the left hock. Look at this. But most likely what's happening is that this is actually fused already, and that's why he doesn't feel pain, because he has fused, and that's why he's lame only on the right hind, or at least mostly on the right hind today. He's an older horse. He has multiple issues. I don't want to complicate your video more, but I'm going to show you something also interesting. This is the fetlock of the right hind. We can see there's a little bit of remodeling on the proximal P1 right here. We can see a little bit of remodeling. So he's also developing some arthritis on this particular fetlock. That's why we are going to treat this horse with, we like regenerative or orthobiologics for this horse, especially because I just showed you that it could start developing, it probably starting to develop Cushing's. Most of the horses at that age develop Cushing's disease, and what that means is there's a lot of steroids going on in the body. So traditionally, we could only treat these horses with cortisone, like the Pomedro, Vetalog, betamethasone, but now we have other products, regenerative products or orthobiologics or natural products such as PRP, Alpha 2. We also have some new synthetic products that are very, very good for the joints, which is called polyacrylamide. My favorite is Arthremed. It's 1% polyacrylamide, works really good. So let's go and treat this horse. We're gonna go and recheck this radiograph of the right hock. We'll recheck the left as well. Look at the left over here. This is significant fusion. This probably doesn't need treated anymore as long as it stays fused like that. We'll see what the x-ray looks like today. I'm excited to see. Let's go. So after looking at both hocks, radiograph and ultrasound of the stifle, we are going to make the decision of not injecting those hocks and go straight to the stifle with Alpha 2 and Arthremed, and we're going to evaluate the response. So this has to be sterile because we're going to go in a joint of the horse. And to go in a joint of the horse, which is a very delicate environment, we have to have a very aseptical process. So what we're going to do is we're going to go first with the Arthremed, and then we're going to go with the Alpha 2. Okay, Mr. Roy. Ready. There's the needle. There's a needle right there, and the needle going in the joint right there, and the product going in right there. Ta-da! That's the product going in the joint. Ta-da! Perfect. Jimbo presented today for lameness evaluation. In the past year, he has been treated with Alpha 2M in the Hocks and stifles. He's also been treated with for squamous cell carcinoma in the penis. Today, the squamous cell carcinoma looked good. Temperature was 99, heart rate 48, respiratory 12. And radiograph, lameness evaluation showed that he was 2 out of 5, right hind positive to upper limb flexion. After the upper limb flexion, we terminate. Let's look at those hocks and see what the hocks are doing. The left hock is actually completely fused, so we're not going to do anything on it. The right hock is about 90% fused, so we decided not to do anything on it either. But the right stifle showed thickening of the capsule and mild inflammation in the femorotibial joint, the middle femorotibial joint. We injected 6 cc's of Alpha 2M and 1 cc of 1% polyacrylamide, which is Arthremed. We gave him 10 cc's of Banamine, which is 500 milligrams of fluniximab IV on the right vein. The horse was sedated with 4 milligrams of delmosudam or the Tomidine and 5 milligrams of butorphanol. Instructions: he's going to rest for 7 days, and after 7 days he's going to start normal exercise. You can do Equine or joint supplements as wanted. You can do a loading dose if you want, 4 cc's every 4 days. And you can also, we're also going to stand on Prasent because he does have thicker hair coat. And this hair coat after 20 years could be an indication of early Cushing disease. In the past, we have tested him. However, he does not, I want to be on the cautious side. That's it. Thank you for bringing to us. Have a great day. Good. That was the medical record.